My name is Grace. I'm really excited to be here to discuss the meaning of different types of genetic variants and genetic testing results with you all. Before I get started, just to clarify, since I'm not a certified genetic counselor, I wouldn't be able to give any medical or clinical recommendations specific for any patient, but I can give some background information on genetic variants and genetic testing results. And also there should be a handout in the chat that you can download, so you can refer to that after the presentation, just to go over any information that you'd like to review. So as I mentioned, I'll be discussing the meanings of different types of genetic variants and genetic testing results, and some questions that this presentation will help to answer. Some questions that this presentation will help to answer are: what are genes? What are genetic variants? What does it mean to have a pathogenic or likely pathogenic variant? What does it mean to have a variant of uncertain significance, or a VUS? And is there anything I should do if I or my child has a variant of uncertain significance? To provide some background information, I'll begin with an overview of what genes are. Genes are pieces of DNA that contain instructions for our bodies to do things like make our hair or eyes a certain color. We each have about 20,000 genes in every cell in our body, and we typically have 2 copies of each gene, and 1 copy of each gene comes from each of our biological parents. There can be changes in 1 or both copies of a gene in a given person compared to what we might expect to see for that gene in other people. These changes are called variants, and different variants can have different effects on our body. Variants can be neutral. They can change how a gene works or make it not work at all, or we can be uncertain about their impact. Depending on the effect that a variant has, it can be put into 5 different classifications. These classifications are pathogenic, likely pathogenic, variant of uncertain significance, likely benign, and benign. So what do these classifications mean? Let's begin with pathogenic and likely pathogenic classifications. A variant that changes how a gene works or makes a gene not work at all might cause disease. If there's enough evidence that a variant causes disease, it's called a pathogenic variant. For example, pathogenic variants in the KCNT1 gene cause KCNT1-related epilepsy. If a variant is likely to cause disease, but there's not enough evidence to say with more certainty that it is pathogenic, then the variant might be called a likely pathogenic variant. Both pathogenic and likely pathogenic variants are relevant when healthcare providers are making clinical decisions like diagnosis and treatment decisions. And genetic testing can help to find if someone has a pathogenic or likely pathogenic variant in their DNA. If someone does genetic testing and tests positive for a variant in the KCNT1 gene, this means that a pathogenic or likely pathogenic variant was found in 1 or both copies of their KCNT1 gene. Since KCNT1-related epilepsy is an autosomal dominant condition, that means that a pathogenic or likely pathogenic variant in only 1 of their 2 copies of the KCNT1 gene is enough to cause disease. If someone tests negative for variants in the KCNT1 gene, then this means that no pathogenic variant and no likely pathogenic variant was found in the KCNT1 gene. Next, I'll mention benign and likely benign variants. If there's enough evidence that a variant does not cause disease, it's called a benign variant. And if a variant is likely to not cause disease, but there's not enough evidence to say with more certainty that it is benign, then the variant might be called a likely benign variant. If someone does genetic testing and a benign or likely benign variant is found, these variants are typically not shown on a genetic testing report because there's enough evidence that they do not cause disease. Now I'll discuss variants of uncertain significance, which are also called VUSs. A VUS is classified as a VUS if there's not enough evidence to classify it as either benign or pathogenic, or if there is conflicting evidence with some evidence saying that the variant is benign and some evidence saying that the variant is pathogenic. We're learning more about genetic variants every day, and for some variants, we do not have enough information right now to call them benign or pathogenic, but this may change in the future as more information is learned about these variants. If someone does genetic testing and has a variant of uncertain significance in the KCNT1 gene, their genetic testing result might say something like uncertain or inconclusive. A variant of uncertain significance should not be used to make clinical decisions like treatment decisions. Instead, there should be efforts to gather more evidence about the effect of the variant so that it can be appropriately reclassified as benign or pathogenic. But if someone does have a variant of uncertain significance for KCNT1-related epilepsy, it may be wise to continue monitoring that person for KCNT1-related epilepsy while efforts are being made to reclassify the variant. If you or your child has a variant of uncertain significance in the KCNT1 gene, there are other steps you can take in addition to monitoring for KCNT1-related epilepsy. One important step to take is to make sure that you have provided up-to-date contact information to the healthcare provider who ordered the genetic testing. And this is so that they can contact you if the variant is reclassified as benign or pathogenic. You can also reach out to your healthcare provider or to the genetic testing laboratory from time to ask if there are any reclassification updates for the variant. You can also ask your healthcare provider if there is further testing that can be done to help reclassify the variant. Testing known as functional studies may be able to test the effect of the variant, or it might be helpful to do genetic testing of other biological relatives. For example, if a child has symptoms of KCNT1-related epilepsy and genetic testing finds a variant of uncertain significance in the KCNT1 gene, it can be helpful to do genetic testing of both biological parents. If the variant is not found in either biological parent, in most cases this can mean that the child has a de novo variant, which is a variant that has occurred for the first time in the child instead of being passed down through the family. A de novo variant can provide evidence for a variant being pathogenic. It's not enough evidence on its own to call a variant pathogenic, but providing this information could be helpful in the overall process of reclassifying the variant. Another example of potentially helpful family testing is if a patient with a variant of uncertain significance has other biological relatives with similar symptoms. If these relatives with symptoms get genetic testing and also have the same variant, and if other relatives without symptoms get genetic testing and do not have the variant, this can provide evidence for the variant being pathogenic because it might tell us that it is the variant that is causing these symptoms. On the other hand, if the relatives with symptoms do not have the variant, and the relatives without symptoms do have the variant, this can provide evidence for the variant being benign because it might tell us that it's not what is causing symptoms. Again, these pieces of information are not enough evidence on their own to call a variant benign or pathogenic, but this information might be helpful in the overall process of reclassifying the variant. Finally, if you have any questions about a genetic test result or genetic variant, you can speak with a genetic counselor. Genetic counselors are healthcare providers with advanced training in medical genetics and counseling, and they can help you to understand genetic information. If you don't already have a genetic counselor, you can find one by visiting the National Society of Genetic Counselors website at findageneticcounselor.nsgc.org. And for some background information, this presentation was based on the standards and guidelines for the interpretation of sequence variants, a joint consensus recommendation of the American College of Medical Genetics and Genomics, and the Association for Molecular Pathology. And with that, I'm happy to take any questions that anybody has.
Well, thank you, Grace. I really appreciate it. And also, we have a handout in the chat. If you guys can't see it, please let us know. Grace was kind enough to prepare that, and it was a very informative PDF that can give you an overview of this. So, open the floor to any questions anyone may have. Well, let me kick it off with a question for Grace. Grace, I'm often wondering. In KCNT1, it's really unique. There's a ton of variants out there. When in our registries that we're looking at, I mean, we'll see 40, 50 different genetic variants out there across a lot of people. But one of the interesting things with KCNT1 is about half of the variants are just a handful of variants. But across the community, there's so much diversity in phenotype. You have some kids that are really affected. You have some kids that are less affected. You have early onset. You have late onset. What's the impact, do you think, of someone having the same variant as someone else but looking so totally different with their clinical manifestation?
Yeah, so that's definitely something that can occur in KCNT1-related epilepsy and in a lot of other genetic conditions. Two people can have the same variant, even two family members can have the same variant and can show different symptoms, or there can be one person who does have the variant and shows symptoms, and one person who has the variant and doesn't show symptoms at all. So it's important to consider both the variant that someone has, but then also the symptoms that they show in order to provide the most information that their healthcare providers can provide them to help come up with helpful treatment and management solutions because genetics only explains part of this picture that we're seeing. It's not one size fits all. So this different people can have the same variant, but they might still have different symptoms. So it doesn't exactly tell us exactly what those symptoms will look like, just even if we know which variant someone has.
Grace, do you want to explain what functional testing is that you mentioned?
Yeah, sure. So there's some testing that can be done. If you take the variant that a patient has shown, sometimes that variant can be used in testing with different, it's like different testing in cell lines that can be done in a research lab so that researchers can look at what effect that variant might have on a cell. And so in KCNT1 related epilepsy, there have been studies before where maybe there's a variant that's pathogenic and researchers are interested in seeing what exactly this variant does. So they take that variant, that information that they've learned from a patient, and they can express that variant in a cell in a system outside of the patient in order to see how that variant impacts, let's say, like electrical currents, since KCNT1 encodes a potassium channel. Um, and so it's testing that can be done in a laboratory in order to see the impact of a variant. And that's especially done when we don't have enough information on these variants. Like if we haven't seen them in enough patients, it's like another form of testing in order to gather as much information as possible. But functional studies, they're not always possible to do for every variant, or they haven't always been done for every variant. So it's something that's worthwhile to ask a genetic counselor if you have a variant of uncertain significance, if you want to ask a genetic counselor what other testing can be done. Are there any functional studies that can be done in order to highlight what exactly this variant might do?
I have another question. So what would be a reason why somebody might want to be sure that their variant was reclassified? Would having a VUS or uncertain significance exclude them from something?
So having a variant of uncertain significance, it doesn't rule out a condition and it also doesn't diagnose a condition. So it's helpful to reclassify that variant so that it can be said with more certainty that this variant that we see is the cause of symptoms that a patient has, or and that's if it's reclassified as pathogenic, and if it's reclassified as benign, then that gives additional information that the patient's symptoms aren't caused by that variant. So it might be helpful then to keep looking for other genetic variants that someone might have, or to understand that maybe it's not a genetic condition. So it can definitely be helpful to reclassify a variant to make sure that you're getting diagnosed as accurately as possible. And then you can take on whatever treatment or management recommendations might be most appropriate based on that diagnosis. So it's all just about gathering more helpful information to help you and your healthcare providers come up with the best treatment plan for you.
Hi, Grace. It's Amanda, and thank you so much for your presentation. I have a practical mom question for you. When my daughters were diagnosed with KCNT1 and I received that genetic report, um, I received it, received instructions, and then just kind of kept going with life. But I
Mhm.
put that genetic report in the background. How important is it that I know and like memorize the location of the gene and try to find somebody who's a match with the specific gene mutation location that I have?
Yeah, so it's definitely, it's not that you would need to know in particular all the details of your genetic mutation or genetic variant, for your child. I think it's most important to, uh, seek out healthcare from providers who can take that information and help you to the best of their abilities, because it can be difficult information to understand. So I think it's helpful to, if you know what genetic variant your child has, to be able to speak counselor, and they would be able to give you as much information as possible regarding that variant, so they can help sort of take some of that, off of your plate and help you to understand the variant, in the sense that you would need to understand it. But yeah, I totally understand. I feel like sometimes those genetic testing reports, they have a lot of information so that any healthcare provider that looks in it can see it and understand it, but it's not necessarily that you need to understand everything about it for yourself. I think the key is to, seek out a genetic counselor who can help explain that to you.
So you're saying save this in an accessible folder, maybe on my computer, so that I can use it for different things that I might be involved in with my, with the groups, but not necessarily focus in on it. Find somebody who can help me.
Yeah, I think it mainly be just about speaking with a genetic counselor who could like tell you whatever information you need to know about it versus trying to like totally understand it yourself. Because I think a lot of times too, it can be helpful, for guiding kind of treatment decisions, but I think it would be hard to sort of know what to do with that genetic information on your own and interpret it yourself. Whereas genetic counselors, at least they have that sort of formal training in order to interpret, that specific variant and be able to provide any recommendations based on that.
Thanks, Grace.
And I'd add something to that. It's also worth it with the potential for upcoming clinical trials in the next couple of years. It would be good to know if you had a pathogenic or likely pathogenic diagnosis, because that would be your inclusion criteria for getting into those clinical trials. And if you have a VUS, you can speak with us and we can, do our best to help put a path forward for reclassification.
Great. Thanks, Brad.
Definitely worthwhile to know if I think for patients and families, it's most worthwhile to know the classification of the variant, whether it's pathogenic versus likely pathogenic versus VUS. And then in terms of the details, I feel like then that, in terms of the specific variant itself, a genetic counselor can help with that.
Grace, you kind of mentioned this already, but I know some people on this call have more than one genetic variant, more than one gene with variants. How do you figure out which one of those genes is causing the most problems for you? And, is that what your genetic counselor is going to help you do?
Yeah, genetic counselors would definitely help with that. It can be hard to say like definitively because it does vary so much from case to case. And so with a genetic counselor, what's helpful for them is that they can look at not only the variants that you have in the different genes, but also look at the patient, as the person that they are, so that they can see what symptoms they might have and what experiences they've had to sort of take into account your symptoms and your variants and how all of those interact so that they can interpret those variants in the context of a specific person's symptoms in order to help explain that a little better.
I'd like to know a little bit about you, Grace, and how you got interested in this and what you plan to do with the future. We loved having you as an intern. Where do you see yourself going next?
Yeah, I've loved being an intern. Yeah, I got interested in genetics because I have a cousin with a genetic condition, cystic fibrosis. And so I wanted to do something in genetics to help people like her. And I worked in a research lab, but then realized that I wanted to work more so with patients face to face, just because I love that human element of the work. And so that's what led me to genetic counseling. And yeah, after this, I'm going on to do some different clinical rotations in different areas of genetics. So cancer genetics, prenatal genetics, all those different areas. And yeah, I hope that after I graduate, just to become a certified genetic counselor and be able to see my own patients. So I'm looking forward to that.